So my name is Sara Nelson, and I'm a physical therapist. I own a clinic in Eastern Washington. I hide out in that corner of the state, in that country. You can see by the things under my name, I like to learn a lot. I have nothing to disclose to you. This is what I hope to share with you today. Evidence-based medicine requires three things. Research is just one of them. Client preferences and clinical experience are the other two. And I have spent my time as a therapist, which is approaching 30 years, being a committed clinician. I enjoy working with people who have obscure, ill-defined illnesses that nobody can help. And sitting across from those people and saying, what's going on? Let me help you figure this out. I want you to have a happy and healthy life. And along in that journey, I've had my own journey of having an autoimmune disorder that's been obscure and ill-defined, which has defined my practice as well. I hope that this occurs. I'm not going to spend time on this slide. So why do I think abdominopelvic congestion is important? I think that I've treated swelling now for 20 years. I'm a manual lymphatic drainage therapist, and I started noticing all this buildup of fluid in the abdomen, and I asked what was going on. And I started to think, this is there first, and it's not being noticed until then it spreads. And so it complicates limb swelling, and I even started to wonder, could this be what creates visceral fat? You know, they say visceral fat is so much worse for you. We'll talk about that. I think I have that in another slide. There we go. So these are the 5 things I came up with, and we're going to break each of them down. So here we go. We're going to talk about all of them. The first one is there's actually a pelvic congestion syndrome. And if you look at the symptoms, I'm wondering how many of you might be able to relate to them. That having an increased aching and pain after sexual intercourse, with menstrual periods, with prolonged standing, or when being tired. This condition especially shows up in pregnancy. So what you're seeing in that picture is a dilated vein in the pelvis. And we think of varicose veins in the leg, but I'm thinking, my goodness, I think they start because of a backup in the pelvis. And then, lo and behold, there is a condition that they name. And I love that they say that it only affects people under 45. This would then be the only condition that doesn't get worse with menopause. Suddenly your veins get all better. But I think it's still there, we just don't complain. And the other thing is that it really increases with pregnancy. And I've had someone with this condition during pregnancy that prompted the poster presentation I did at the NLN. And the woman was on her 4th baby, and the labial swelling was so much, the veins were so large that she was almost bedridden. And you can see 45% of people with chronic pelvic pain have this condition. And it was new to me, and I'm supposed to be a therapist. If you'll notice too, polycystic ovaries are part of the problem, as well as hormone dysfunction. Now we're getting into the realm of lipedema. So this is how I think. I like to go back to root cause. So everything Dr. Herbst said, just amen, now I'll go. Because she was spot on with the things that I see too. So the venous congestion here backs up into the leg. That leads to that lymphatic compensation. The lymphatic system is in the background working hard to keep up until it finally can't keep up. Then we have chronic inflammation, fatty tissue proliferation, and a worsening of lipedema. So what do we do about that? It's really nice to know what it is, but what do we do about it? So the last thing on the list, I'll just mention first, the interventional radiology to seal a dilated vessel. I actually had a patient who had that done, and it did help. The woman had a chronic pain here that just wouldn't go away, and then once she had that surgery and we did a graded exercise, it got better, not immediately. She had to work at it. So let's talk about that graded exercise, and I think this is a takeaway that you can all have today. So if you see the guy on this side, what we tend to do is when we pull in our belly, this comes in and that goes out, especially with swelling. Swelling inhibits muscle. And so when I pull in here and let that go out, I'm creating a downward pressure. I'm also a board-certified women's health specialist, so I do a lot of urinary incontinence and prolapse, and I'll tell you, you can reverse prolapse, so see a women's health therapist first. And this will get you started. And if people can't do that, that's where the manual therapy comes in and the guided training by a physical therapist. So a simple start, though, is put your hands in the air and take a big breath in, let your ribs stay out, and exhale, and imagine that space between the belly button and the pubic bone coming inward. And so you should feel a little tug right down here. And if you don't, come and see somebody like me, so that we can start to look more like when the belly contracts, that the whole thing comes in together. I do manual lymphatic drainage and I do fascial release. And when I learned about fascial release, I took John Barnes' myofascial release. I studied it to the advanced degree. I studied craniosacral therapy to the advanced degree. And I have spent 17 years studying visceral manipulation. These are all fascial releases. I could list 20 more. It is correct that we want to get into the connective tissue and work that too. And I would argue that getting into a fight with your body with deep tissue is a losing battle. The body responds to gentle pressures applied specifically. And so I promote more of the light touch therapy and having a therapist who understands how to work in the barrier of the fascia and create a change without engaging in this battle, which is sort of when manual therapy is a deep tissue fight, it's sort of what we're doing in the world. And I think we want to be gentle and loving to our bodies and help the body change gently and lovingly, and that can happen. Visceral manipulation is a very specific technique to learn, like the ligaments that suspend the organ and the fascia that connects and supports the organs. So I'm generally clearing with manual lymph drainage and then working the fascia and then coming back to the lymphatic drainage, and that works very well in abdominal swelling. So I just went on the internet and looked for pictures to illustrate my point. So my next point is post-surgical scars and adhesions. This is my playground. Sorry. And so the reason I picked this picture, and this doctor got beautiful results, but do you see the line of swelling that's present before and after in different places, but still this woman has a low-grade swelling. So what I noticed with these adhesions are causing impaired lymphatic drainage. Now, if it was a great big compression on a vessel, it would be a medical emergency. But a minor impingement that impedes flow so that at the end of the day you have more fullness and swelling and you don't feel very good, but it's not killing you. You're not going to get attention until it's bad. So now I have a very skewed public, right? The people that I see are having trouble, but I would have to say that I have not seen a gallbladder surgery that doesn't have chronic swelling and sets up a great problem through this area that can make things worse. So now I've practiced 20 years in the field of I call it lymphostasis, when the lymph system just isn't working very well. And so my patients are aging, and oh, goodness, they end up with surgeries. They end up with hysterectomies. So there's an endocrine issue. The endocrine issue is leading to the need for some of these surgeries, the digestive problems as well. And I'm seeing these problems worsen their lymphedema and their lipedema. I'm thinking of one person in particular. Okay. So I went looking in the literature and said what's out there, and I found this textbook, and this was reported in the textbook of managing adhesions. All my references are at the end of this study, or end of this presentation, and you can see almost a quarter of women who are dealing with chronic pelvic pain have adhesions and scarring, and 80% of the people who have had abdominal surgeries have adhesions. That's a huge number. So we'll send people in to rehab after a joint surgery, but we don't send them after abdominal surgery. So the picture of the organs on this side are to illustrate to you what adhesions around organs look like. So scarring acts like glue, and it sticks to everything, and it creates connections that weren't meant to be there. That'll even build vascular connections. I picked this picture, again, because some plastic surgeon did a beautiful job, but nowhere in the description did it say that this woman had lipedema, and I would say that she does look like she has lipedema, that normal upper body with the larger lower body, the congestion at the hips. Please make note. So the above picture was the before picture. The lady had a mesh hernia repair that failed, and I would say that that's also an argument for why you need somebody like me helping, because if a person does not know how to use the dynamic of the abdominal wall, they're going to blow out any repair. And that's a great example of don't fight your body, learn to work with it. So what happens, so the surgeries can lead to swelling. This can impact organ system, lymphatic and vasculature. We get muscle inhibition, the downward pressure, and then a worsening of the swelling in the legs. Okay. So again, my treatment options here, and I want to take this moment to say, be careful of who you're having do your manual lymphatic drainage. The original Dr. Vaughter method was not copyrighted, and so many people say they do that method. The people who teach the original Dr. Vaughter method demand that their therapists have 160 hours of training and repeat every 2 years their manual skills. Last weekend I was doing that, and I've been doing it. I'm in my 20th year, and I'll keep going back because I want to give my patients the best. The other thing with manual lymph drainage that's happening, that's being driven by insurance, is that people are seen once a week or twice a week. In order to jumpstart the lymph system, you need to treat it every day, and it needs to be within a program that's well-rounded, and I think that well-rounded program, some of it will come out as we go along here. The other thing is that I can't mash these things together and build my own course, and now I'm going to go out and teach the therapists that treat you, and they'll be the best ever. I have dedicated my career to manual skills. It's as refined as what a surgeon does. You need to find a therapist who's dedicated to learning. As far as movement training, what I have come to believe is that this is a congested area, and that's why the swelling builds up here. And if you do, I do a lot of yoga. If you do hip opening and this sort of thing, you can decrease this swelling. I don't have a lot of time to explain why, but I always like to give people a reason to call me back. Okay, so this first statement is so true. The American Medical Association came out a couple of years ago and said, obesity is a disease of chronic inflammation. So usually all my patients that are dealing with fatty tissue deposition, I said, okay, you're going to go home and not call yourself fat for a week. Tell yourself you have a disease of chronic inflammation. Because we want to start seeing ourselves in a different framework so that we know we have a different way of approaching the problem. And we know that lymphedema is also a disease of fatty tissue proliferation. So there's two sides of the coin. So I said, what's happening? Why is that happening? And this is amen to Dr. Herbst, because I also found when I went looking is increased capillary permeability in the standing position is related to a deficit in the sympathetic nervous system. And it can be an underlying mechanism for several conditions. In this article, they hypothesized chronic fatigue, fibromyalgia, repetitive strain injuries like carpal tunnel could all be explained by this, and now we know we could put lipedema on that list in Derkham's disease. So these the sympathetic nervous system is the thing that runs everything in your body that's on automatic. That's 80 to 90% of what's happening in your body. And so suddenly that becomes a key focus for me in the therapy clinic, because when that triggers these events, we're back into worsening the lipedema. So this is an argument, I think, for these things here. First of all, the stress management. I redefine stress for people because it's another word. It's like fat. It's got too many things associated with it, so we want to get specific. Stress is adaptation to change, and the body is constantly adapting to change from internal and external cues. So for some of us, just to be sitting here right now, your body is working harder than the guy next to you to be in a balanced state. And so what we want to do is help the body be in a balanced state by using different strategies. I have another slide for that. The other thing is eating strategically. So I, at one point, did not have a friendly relationship with food. And so eating healthfully, it doesn't work for me. Eating strategically does. So if I look at my food like, is that going to get me the end result I'm looking for? And when I was able to link my pain with what I was eating, it was easier not to eat certain things. And when I also took the approach that I love food and I'm going to eat stuff that makes me feel good and I enjoy, that became an adventure. If you are eating stuff because it's good for you, that's a form of resistance, and that's going to be stress on your body. You might as well eat what you want. We know through research that manual lymphatic drainage accesses the autonomic nervous system and will calm you. I get people, they come in for one reason, post-surgery, and I can't get them out the door because they feel so good with the manual lymph drainage as a tool to maintain health. So another reason that I think abdominal swelling gets worse is, I've got the 2-minute mark, is lymphatic vasculature of the ovaries. We know now everywhere you see a blood vessel, you're going to have a lymphatic. This picture is showing what happens in heat in a pig. In the top picture, those bottom vessels are enlarged. That's happening for human people too. The lymphatics fill during the period. this picture is to show the Australian lymphedema group is doing some amazing pictures. Google them. So these neuroendocrine triggers could be some of what's making things worse. Tomorrow you're going to hear about yoga. Yoga is a huge way I manage my inflammation. Listen carefully. I think digestion plays a role. And there are lymphatics in the digestive tract, so that when the digestive system is having problems, the lymph system is going to be overloaded. When the digestive system is having problems, more fluid gets pushed out into the belly. Maybe some of you notice if you eat certain things, you get more bloated. And that's an argument for why we want to look at eating as a way to heal the digestive tract. In the long run, the most powerful thing you do is how you move, how you eat, and how you live your life. And these other things are temporary stops while you learn those things. I thank goodness, for the medical help that I've had, but the things that have helped me be happy and healthy are the things that I do for myself every day. So that little circle there is all the things that I could think of, like meditation, time management, sleep hygiene, body work. That's the manual therapy. I get treated regularly myself. Cognitive therapy, leisure, and exercise or yoga. I'd also like to mention very quickly, thanks to my son for teaching me that he's an Ironman, and he taught me about heart rate variability, and I'm using this with all of my patients right now. It's a way that you can objectively measure your vagal tone, and it will help you to know how to exercise. Most people are exercising too hard, and if you already have an autonomic system that's under stress, the right exercise is key. That's a tool that will help you. So in summary, the conditions of pelvic swelling are often underappreciated for their impact on lipedema and health in general. If you consider the underlying mechanisms, why you're doing what you're doing will make more sense, and it becomes less something that's put upon you and more a game, a strategy for how you're going to get well. And MLD and visceral manipulation, these are effective tools and important tools to be part of your healing. These are all my references. And let's see. That's where I live. That's how you can get a hold of me, too. That's my contact information. Did I do it? Okay. Thank you very much for having me.